In curative medicine, AI has the potential to use large datasets to help clinicians in difficult decision makings and improve the patient outcomes. For knowing whether a lesion is cancerous or not, normally surgeons rely on experience and it's subjective.
At the global campus of Ghent University in Korea, we are building AI models that analyze surgical video content to detect cancer and assess its extent.
We introduce small cameras into the abdominal cavity to capture the surgical field.
Using annotated data from real operations, these AI models learn to distinguish cancerous tissue from healthy tissue by recognizing subtle visual cues such as texture, color, and shape. In early experiments, our AI models have shown strong potential, outperforming human observers in identifying and characterizing disease. The aim is to empower surgeons with intelligent tools that support more accurate, confident decision-making, and ultimately improve outcomes for patients with abdominal cancer.
Also, in other branches of biomedical research, the benefit from new AI technologies is clear. In our lab, we study how AI models can be used to make sense of large amounts of molecular data about cells and tissues in the human body. This can help us understand how our cells and tissues function, both in normal as well as in disease states. In collaborative projects with clinicians, trustworthiness of AI models is a key issue. That's why we focus on developing robust and explainable AI models that can be adopted more easily in the clinic. As an example, we recently developed a new AI model that can better diagnose patients with primary immune disorders, a heterogeneous group of diseases where a rapid diagnosis is key. By letting the model explain its decisions to clinicians, they can better judge whether diagnoses are made for the right reasons.
But with power comes responsibility. At the Department of Philosophy and Moral Sciences, we have several ongoing projects looking into the ethical concerns related to the leveraging of big data and AI for clinical applications. Examples of topics that require ethical reflection are the power divide between citizens and those controlling the health data markets, bias, and a lack of transparency in how AI outputs are obtained, and how historic injustices, stigmatization, and discrimination may be exacerbated through AI applications. It is important to critically take these ethical concerns into consideration in order to evaluate the promises of AI and whether and how it could serve the public interest.
When we look at those clinical AI applications from a health technology assessment perspective, then ethics is obviously of central importance. But we also need to consider several other criteria in our evaluation. First of all, we look at the effectiveness or the potential effectiveness of the tool. Is it really going to be better in terms of outcomes compared to what we do today? A second criterion is safety. What is the chance that the system will fail and lead to undesired effects? And what are the consequences of such failure? And then, of course, there are the health economic aspects, because AI-enhanced surgery is likely to cost more. Will it be value for money? In other words, is it going to be cost-effective? And who will pay for it? The healthcare system, or the hospital, or the patient? The latter is, of course, not preferable. And then finally, the organizational aspects. What are the implications for the workflow? How will it impact the role and the functioning of humans?
At Ghent University and Ghent University Hospital, we believe that responsible AI in healthcare starts with strong collaboration. That is why we launched Hint.Ghent, the Health Intelligence Network, a multidisciplinary initiative uniting experts in artificial intelligence, medicine, ethics, education, and beyond. Our mission? To stimulate groundbreaking research, renew education to keep pace with AI developments, and ensure that innovations are implemented in a responsible way, aligned with the needs of patients and caregivers. Hint.Ghent is more than a network. It's a movement towards a future where humans and AI work together to improve health and healthcare. Discover more at Hint.Ghent.